Gracie, you study here at Hungkuo Delin University of Technology, right?
Yes.
Okay. Let me just ask you a question or two questions. You know, now we have COVID-19 problem, right?
Yeah.
So how do you feel studying in such an environment when the disease is spreading like wildfire? How do you feel? Are you afraid of coming to the class or no?
No, I think here studying in Hungkuo University of Technology is safe. How they deal with this problem, and they check our temperature, students' temperature, whoever can come into school, and then we have use the alcohol base to rub hands and make clean, and also check our body temperature if too high, or they will ask us to stay home and rest. I think how our school they deal with is good and make us feel safe.
So you feel very confident about the process, how this university takes care, right?
Yeah.
Okay, and what about in the classes? Does everybody wear masks during the class, and teachers and students?
Yeah, teacher and students during the class will wear masks, and teacher will mostly keep distance and ask students to keep distance like 1.5 meters.
Okay.
Stay away. Yeah.
So that is called social distancing,
Yeah.
just to avoid any physical contact or spreading the virus, right?
Yeah.
So what we can do right now is just let's wish that this coronavirus, COVID-19, will be finished soon.
Yeah.
Right? Okay. Thank you.
Thank you.
Bye-bye.
Bye.
What is COVID-19? Oh no, today I'm going to tell about, to begin I will tell about what COVID-19 is and when and where it began, and the statement all over the world and in Taiwan. And I will explain why there are more people infected in the Western countries. And at the end, I'll tell you about how our university handles this problem, and also give you some advice on how to protect yourself from COVID-19. So to begin, what is COVID-19? It's an infectious disease caused by severe acute respiratory syndrome, coronavirus 2. And it's first identified in December 2019 in Wuhan, and it's the capital of Hubei province. And how does it affect? It spread between people during close contact, and spread by droplets produced by coughing, sneezing, or talking. And common symptoms are included fever, cough, and fatigue, shortness of breathing, and also loss of smell. And I'll tell you about the 2019 to 20 coronavirus pandemic. And what is the pandemic? It's an ongoing pandemic of coronavirus disease 2019, which is COVID-19. And the World Health Organization declared the outbreak of this virus on January 30. And then they declare a pandemic on March 11. And this is the statement till yesterday. Yeah. And there is 3.13 million cases of COVID-19 have been reported in 210 countries and territories. And there are more than 218,000 deaths, and 959,000 people have recovered. Okay. As the case here in Taiwan, till week 18, it's in April, there are 429 cases are reported and 6 deaths, and 311 are recovered. Please look at this picture. The red ones are the cases reported with more than 18 cases, such as Taichung, Taoyuan, Kaohsiung, and Taipei, including New Taipei City. And in Taipei are the most reported cases. There are 116 cases. And now, so we see the difference from the Western, over the world and here in Taiwan. So Taiwan is much lesser than over the world. See, and here is U.S. U.S. is the most, it's going hard, and then here is China. And in comparison, we are less than Western countries. We will take America as example. It had why there's more, because they don't have experiences like here in Asia. We have like SARS in 2003 in China, Taiwan, and Singapore. And at the same time, Korea has MERS in 2015. So, and the second reason is the Western countries that take actions too late. They only take seriously when the outbreak of Meetei, then they started taking actions. Like, and they are used to seeing things, horrible things, and they don't think it will affect them. It's said by the Dr. Slutkin, an American epidemiologist and former WHO official. And U.S. President Donald Trump agreed to recommend social distancing rules after the U.S. confirmed its first case on January 20th. It would be almost 2 months later. And to compare with Eastern country, I take Singapore as example. For Singapore, they one step ahead of the virus since they have the experience and they are strict in laws and their governments. And for Japan and South Korea, they have 7 to 8 acute care hospital beds per 1,000 people. And while UK and Italy, they only have 2 to 3 acute care hospital beds for 1,000 people. They don't have enough spaces and ventilators. And here in Taiwan, I'll now tell you what our university does. We have before entering the school, we have alcohol hand sanitizer to clean your hand. Then we will walk through the scanner to check your body temperature. And also, in every classroom, there are sterilized water for cleaning the table. And we are asked to wear masks during the classes, and also keep social distancing while we are in public, and such as library and cafeterias. Okay, to finish my speech, you all know what is COVID-19 and when it begins. And because of their non-experience and lack of preparation before the outbreak in Western countries, they are more infected and death. So the best way to prevent is avoid being exposed to this virus and wash your hands frequently, wearing a mask, and the most important of all is to keep your immune system strong by doing some exercises. Yeah, and this is my speech today.